Can anxiety be treated? How does treatment actually work? Does your heart often race? Do you feel short of breath? Do you struggle to sleep, with your mind unable to stop thinking? And sometimes, you believe you have a serious medical condition. You go to the doctor, have an ECG, and undergo tests. But the results come back normal. Even so, the fear does not go away. You keep worrying. You keep searching. You keep checking. And little by little, your life begins to revolve around those symptoms. There is something many people do not realize. The scariest part is not what you are feeling. It is the way your brain is interpreting those sensations. That is also why so many people ask themselves, if this really is anxiety, can it actually be treated? Or will I have to live like this forever? Today, we are going to find out together. Part 1. Can anxiety be treated? The answer is yes. Anxiety disorders are among the mental health conditions that can be treated effectively. That does not mean every symptom will disappear after just a few days. It also does not mean you will never feel anxious again, because anxiety is a normal human response. The goal of treatment is not to eliminate anxiety completely. It is to help your brain activate its alarm system, only when there is real danger. Many people, after treatment, sleep better, experience fewer panic episodes, spend less time overthinking, and are able to return to their normal lives. The most important thing is, treatment does not just reduce symptoms. It also helps your brain relearn one thing, that you are safe. This is the foundation of most anxiety treatments used today. Part 2. How does treatment actually work? Many people think treating anxiety simply means taking medication. But in reality, not everyone needs medication. One of the treatments with the strongest scientific evidence is cognitive behavioral therapy, also known as CBT. CBT does not teach you how to never feel anxious again. Instead, it helps you understand why your brain creates fear. For example, you are sitting quietly, and suddenly your heart starts racing. Your brain immediately concludes that something dangerous is happening. Right afterward, you begin paying attention to every heartbeat. You check your pulse. You search for your symptoms. You ask yourself, am I having a heart attack? The more anxious you become, the faster your heart beats. The faster your heart beats, the more convinced you become that something is seriously wrong. In CBT, you learn to pause before jumping to conclusions. You ask yourself, is there real evidence that I am actually in danger? Or is this the same anxiety response I have experienced many times before? You do not try to force your heart to slow down immediately. You also do not try to make the anxious feeling disappear right away. Instead, you learn to observe, accept, and give your body time to regulate itself. Over time, your brain begins to realize these sensations may be very uncomfortable, but they do not necessarily mean you are in danger. This is a very important shift, because the frightening part is not always the symptom itself. It is the meaning your brain assigns to that symptom. Part 3. Why do so many people never break free from anxiety? This is something many people do not know. Anxiety is not maintained only by the symptoms. It is also maintained by the way we respond to those symptoms. For example, you notice your heart racing. Immediately, you think, something is wrong. You check your pulse. You measure your blood pressure. You search your symptoms on the internet. You ask your family, or you repeatedly try to reassure yourself. At first, you feel better, but that relief only lasts for a short time. Then, your heart races again. You check again. You search again. You worry again. Each time this happens, your brain learns one thing: checking kept me safe. And it also learns something else. If I do not check, something dangerous might happen. That is the vicious cycle of anxiety. The next time, your heart only needs to beat a little faster than usual, and your brain activates the alarm even sooner. Your body reacts more intensely, and the fear becomes even stronger. This is also why many people feel that anxiety gradually takes over more and more of their lives. There is something very important to understand. Every time you check in, order to feel reassured. You are unintentionally teaching your brain that you have just escaped a dangerous situation, when in reality, that danger never existed. That is why treatment does not only reduce symptoms, it also helps break the cycle your brain has learned. For example, after you have been evaluated by a doctor and serious medical conditions have been ruled out, the next time your heart starts racing, you do not immediately check your pulse. You do not reach for your phone to search your symptoms. You pause. You observe the sensation. You breathe slowly, and you give your body more time. At first, this can be very difficult. Your brain will keep telling you that something is wrong. But if you do not respond with your old habits, and then nothing dangerous happens, your brain begins to learn something completely new. A racing heart does not mean danger. After repeating this many times, the alarm signal gradually becomes weaker. Your body becomes less reactive, and your anxiety episodes may happen less often. Part 4. What role does medication play in treating anxiety? Many people think, if you take medication, you will be cured. Others are afraid that once they start medication, they will have to take it for the rest of their lives. In reality, neither of those beliefs is completely accurate. Not everyone with anxiety needs medication, but when the symptoms become severe and begin to affect your sleep, your work, or your daily life, your doctor may recommend medication. The most commonly prescribed medications are antidepressants, such as SSRIs or SNRIs. These medications do not make anxiety disappear immediately. Instead, they help make your nervous system less sensitive to signals of danger, so that your brain is no longer constantly stuck in alarm mode. These medications usually take a few weeks before they begin to work, and they should always be monitored by a doctor. The important thing is, medication is not a replacement for CBT. Medication helps calm your body. CBT helps retrain your brain. When used together appropriately, many people experience significant improvement. Part 5. What can you do starting today? If you frequently experience symptoms of anxiety, do not try to deal with them alone. The first step is to see a doctor or a mental health professional for a thorough evaluation, because not every symptom is caused by anxiety. If you experience severe chest pain, serious shortness of breath, fainting, or any new symptoms, seek medical attention immediately. Do not assume that it is just anxiety. Once dangerous medical conditions have been ruled out, treatment becomes clearer and more effective. In addition to treatment, you can also support your recovery by getting enough sleep, exercising regularly, limiting caffeine if you notice that it makes your symptoms worse, and staying connected with people who can support you. Most importantly, give yourself time, because your brain did not learn these patterns in a single day, and it also needs time to learn new ones. If you are living with anxiety, you are not alone, and you do not have to live this way forever. Many people have improved. With the right treatment, there is one thing I hope you remember after watching this video. The goal of treatment is not to make sure your heart never races again. It is not to make sure you never feel anxious again. It is that when those sensations appear, your brain no longer interprets them as signs of danger. That is when the vicious cycle of anxiety begins to break. If you are still wondering why anxiety can cause a racing heart, insomnia, a mind that never stops thinking, or a lingering sense of unease, I have another video that explains in detail what is really happening inside your body. That video will help you better understand why these symptoms occur and why they feel so real. Thank you for watching. Don't forget to like and subscribe to the channel. Check out my other videos to learn more useful tips about medicine and health.